track anyways, right?
I do.
So for quorum purposes, I just want to reiterate, this is really important. If you're, present, I think if you're present and you're not, you're on virtual, your video actually needs to be on for you to be considered part of quorum. It does, and ideally what we would like you to do if you're not here, just tell us why you're not here. We as a group have never really come up with our reasons that are acceptable or not. But I think we use common sense on that. I mean, if you can't be here, you can't be here. You're really important that you're involved. So now that I've done enough of that stuff, we'll just go down the list. Alexandra Sosnowski. Ali Saku. Andy Hessian.
Present online due to a meeting conflict right after this meeting.
Awesome. That is you're a role model for how.
She always says.
Ann Landry. Ann Potosik.
I'm here. I'm
Nice to
not
meet
with you guys down the street just because I'm the only engine in town right now.
Support.
I should know how to say your last name. How do you say your last name?
Potozak.
Did I say it right?
Yeah, just cross out, I do everything phonetically, cross out the C.
Well, I was gonna say Potochuk. But
Well, that's
the-
how they say it in New Jersey.
It's also the Polish in me, but,
You should go with the auction much.
oh my God. All right, you're the chair from now on. Because speak Polish. Hannah Thomas. Benjamin Hilliard. Bobby Bagley. David Nagel, that's me. I am present.
Yay.
Yay. David Rochford. Dee Daly. Ed Shenshao. I don't know why I said your whole name. Yours was an easy name to say. Heather Amur.
Here, I am not in person due to commute time and meetings this afternoon later.
Beautiful.
Is it Amer, Heather?
It's Amer. Yep, Amer.
All right.
He was doing the French pronunciation. We're going all over the place.
Happens too
Sorry,
much. It's
very
okay.
ethnic.
Yeah.
I'm not very Americanized.
Don't irritate Heather. I'm trying to recruit her into a work group, so she doesn't know it yet. But
Although I will tell you that Nagel is not the proper pronunciation of Nagel. So
Nagel?
it's Nagel, actually.
No.
And if you go to a German bar, you'll know that for sure, although I'm not German. Jennifer Johnson.
I am here and I am remote due to my schedule and being under the weather, so I'm not going to show my face.
That's fair. Thank you.
Still better looking than Ed.
You're a good nurse practitioner.
Dude. Wait, nurse practitioner? Well, you can't hire her. Oh, come on. Seems unfair. So now you're recruiting. We're doing this for the roll call.
You can do it offline. Justin Romanello. Kim McNamara.
Reach out to Kim. I haven't seen her for a while.
Lauren Pearson.
Good morning. I am present and joining remotely. My son has a medical appointment following this meeting.
Okie doke. That's an extra special reason.
Yes.
Maddie Parker.
I'm here and I'm remote due to I had an appointment earlier this morning.
Okie doke.
Hey, Maddie.
Maggie Pritchard.
Here in Laconia at the
Right.
office.
My home.
Because somebody has to be.
Well, it's technically not my hometown, but it's close.
Yeah.
Maria Boylan.
Another day I have to reach out. I haven't seen her in a while.
You know, I can talk to her.
Yeah, but relatively again.
Martha McLeod. Mary Reed. This is exciting. I've been preparing for this moment. Megan Heusler. I did it.
We did practice your last name.
I am so proud. It only took 4 meetings. Monica O'Clair. This is interesting. Morgan Harris.
Good morning. I'm here online due to a meeting after this.
right.
Okey-doke. You're keeping track of it.
I am.
Okay. Polly Champion,
I'm here also remote because of meeting conflicts.
good job.
I have a little asterisk next to Polly's name because I think I don't want to lose the opportunities and Polly is in the process of trying to find a replacement. We're going to be sorry to see her go, but it is time for her to have a new life away from us. But 7 really dedicated years with the council, so thank you for all you did.
Good job. Thanks.
Oh, you're welcome. It's been a delight, and it's time to give somebody else an opportunity.
It's the whole concept of aging is near and dear to my heart, and I really appreciate all you've done. It's really important.
Thanks, David.
It's right near my heart, actually. It's right in my heart.
And I'm glad that you guys keep reminding us how important that is. Ruben Hampton.
Good morning, remote due to back-to-back.
Remember the days when we couldn't do that because we had to drive places?
Oh, you're right. Wait,
I miss those days.
I think he's too young for that.
Yes.
Yeah.
Heather, too.
Sue Prentice.
Hello. Yay. Oh, my goodness. Oh, my goodness, Ash. I'm in a meeting, so I can't talk long, but tell me. Yeah.
Well, Suzanne.
Sue?
Doesn't sound like that.
Yeah.
I thought I was so excited because I have never met Suzanne.
Oh, she's wonderful.
Yeah. So anyway, we'll move on.
Tori Jennison.
Good morning. I am here and remote due to schedule conflicts.
Okie dokie. Tricia Zahn.
Here and remote due to having no wheels today.
Oh, that's right. I forgot. We talked earlier. Yeah.
Are you any relation to Dr. Zahn?
I'm not, but I get that question often.
Not
that I know of.
That's just a name from the past. It's like a pleasant memory.
I like a superhero.
Yeah. Whitney Hammond.
What?
Yay. And Bill Palmer.
He had to beg off last minute. I think he's doing a strategic planning in Dartmouth.
That's important.
Yeah.
So we don't have a quorum. Because we need to have 7 present. Right?
Is that what it ended up being? Because I was asking you about
it's the math's easy. What
I mean, yeah, so
people do we have?
5, I think, is 1/7 of what we have.
Is it?
Yeah.
Oh, 1, 2.
But I think you're at 1.
Yeah, we only have 4. So if another person comes, so we can't vote on minutes.
Yeah, okay. We'll just keep pushing that one down the pipe.
It's all right. And what time is it now? So
11:10.
11:10. I did awesome. We have 5 minutes to babble. No, this is really important. So we were going to talk about having a live meeting. I didn't see that on the agenda.
Jess Williams messaged and said she's here online.
Just what it's like.
Oh, she's not on my list.
She may just.
I'm sorry.
No, I think I might have looked her up and I apologize, Jess. I don't know.
Yeah, you're not on my list.
I did
I'm
that.
sorry.
I did that.
So it's Scott's fault. not
It is.
mine.
100%.
If anyone else is.
Oh, yeah, you're right. You're right. Do we have anybody else that I missed? And
Apparently I'm just picking on Jess Williams today. That's it.
And then, is there any, non-public member?
Fowler, it just said she's here as well.
Yeah, Kathy, I don't know how I missed you either. I don't know what I'm doing here. Kathy, thank you, Kathy.
I don't know why I'm writing this down because you are, but.
All right, makes you feel better. Obviously, I need a hammer because I've left 2 people. What's so far?
All right. So just so I know, so did I miss anybody and is there any, public, people present that want to identify themselves? Do you have anybody else on?
I think Peter Eames is coming, but he's not here yet.
Okay.
Yeah.
I'm Chris Simolin from the foundation online.
Oh, Chris, yeah, welcome.
Great. Which foundation?
This one that we're in right now.
Okay,
We're actually the host agency.
Oh, then you need to be here.
Yeah. I think she's probably here all the time, so I don't need to be here.
All right. Since we have a couple minutes, I don't know if we can discuss that, but For quorum, this is like a really big deal to me because I'm watching a committee get disbanded merely because they've never achieved a quorum. And it doesn't mean they don't meet, and it doesn't mean they don't do really good things, but somebody in the legislature got a brilliant idea that they need to go away because they don't meet a quorum. They put a bill in and the bill passed. So they won't exist. And so I think we meet, we do really good things, I hope. I know we do. And it's just, if you have one meeting per year, we can sign off on all your minutes, and we guarantee we have a quorum. Plus, the other thing that I think has a lot of value is the whole concept of collegiality and camaraderie, is that when you actually get to see each other face to face, even if it's just once a year, I think it really does build bonds. And I really thought that what we did last year, and I think one of the first meeting I ever came to was up in Plymouth, and that's what we were talking about, was how do we do that? So that's coming, right, to talk about that meeting.
I just need to know
when and where.
Yeah, June 26th. We're going to put this out right after this meeting, but June 26th, 9 to 11, we'll get us an invitation out. We just don't have the exact in Plymouth.
Yeah.
Okay, so that was our
talk to Spear Memorial.
Yeah. So we are planning an in-person, all the work groups have been a part of the discussion, but for those folks that are, we will put that out. So it's, it would be, June 26th in Plymouth. We're getting a location, from 9 in the morning till 11. In person.
And just to build on that, there's only 4 of us, technically 5 of us here, but, I mean, you don't technically count.
I don't count it all. No, it's not-
So you count as a human being.
It's like you have to be this tall to make a ride, that kind of thing. Yeah.
But at the same point, it's probably a good idea to try to, I mean, we meet, we're gonna meet like 6 times a year roughly right now, we think.
Yeah, right around that.
And it would be a really good idea to plan on maybe being there twice or more, and trying your best to do that. I would never pass a rule that required that. And I'm really glad we were able to pass quorum rules to change the quorum requirements, because I think that brings in all your voices, which wouldn't be heard otherwise. And I think that was a really important thing that we did.
I guess my question was, and I know I sent you some stuff earlier, and I don't read statute particularly well. It's a little bit of foreign to me, but I thought it said the people that were online, as long as, again, as long as their camera was on, could be part.
Yes. Yes.
So in other words,
They count, but you have to have you mentioned the 1/7 number. To have an official quorum,
so
1/7 has to be present, but you still need a majority.
Right.
So it's half plus 1.
So they just solved the majority problem by saying, it, but not the quorum. problem.
Yeah, I mean, well, it made the quorum a lot easier to get.
Right.
So, I mean, we fell one short in terms of live.
No, that's good clarification.
And I didn't want to waste a lot of time on this, but we did have a couple minutes, and now it's 11:15, and I will turn this over to Scott for the next phase of the discussion on update.
Well, we already did, you're way ahead. So just the update on the legislative review isn't spectacular. It's just the work that we went over at the February meeting, going over the different bills that each work group had looked at, has been, for the most part, completed on a little chart we have. We'll send out the link to that. Tori, has taken on the unsightly task of trying to get us a OneDrive and Google site so we can see all this content, because as the state, we don't have an ability to do that. You don't have to be considered, what do we call that when you're
Affiliate.
an affiliate, which we don't want to burden
It
anybody.
mean you get a laptop from the state.
Yeah, I mean, I don't-
Cybersecurity training.
Yeah, we don't need, I don't have any laptops, I don't need any more training. So I thank Tori. We, right after this meeting, we'll get together there and get that link out so that people can see if you're interested in all the bills that were reviewed. I updated them as a few weeks ago, but I'm sure there's been even more changes since then. But I think overall, it was a really fascinating project. I think, Ed brought as he does, the AI component to it. We did a good job, I think, of narrowing 1,300 down to about 30. And I think the ones that we looked at were probably had the most crossover with SHIP domains directly. So, what we do with that next year, what you do with that as a council, I mean, I think that's up for debate. We'll talk a little bit more about that later, but I just did want to thank people. People put a lot of time into that. And it was, for me at least, as somebody who doesn't know a whole lot about legislation, it was quite interesting. So thank you to the work group folks that did all that. And now we'll go to.
Actually, I wanted
Go
to make a couple things. So I can't speak for other legislators, but I can speak for me. It is really important when you send a letter to somebody, that there's bills that came up that weren't even on my radar, that I suddenly realized this is a really important issue. And it's neat because you develop a relationship with that person, but they also highlighted something that was important to me, so that if you tell one friend, I tell two friends or three friends or four friends, pretty much I can tell the entire caucus that this is the issue that was raised. And so I think it's really critical. We're not done yet. There's still a number of bills that are being heard. There's going to be committees of conference coming up. I mean, by June, we're done, but it's still an important time. And the bills that are being heard right now are, in general, the most controversial bills. We get the easy ones done fast, so early. And things go to finance too. So they have second committee hearings. Anything that has a fiscal note will go to a finance committee. So those aren't done yet either. So there's a lot of stuff still going on that you can impact. And like I said, I mean, it was really neat when I got a letter from somebody yesterday about an issue wasn't even on my radar. And it really changed the dialogue of that entire bill. So you do have power.
I mean, I think, Andy, go ahead. I don't want to miss out on your comment. Question.
Yeah, thanks. I just had a quick clarifying question and I think we're going to get more into this later with the work group updates as well. But for that legislative review process, is the intent of that document to educate all of us as the committee so then we can be sharing with our networks as well and for us to take action? Is that right? Is that
I think you bring up a great point, Andy. I think in the beginning, it was really just a way for us to get started looking at it as a council. It's nothing that, as far as I know, this council had ever done. I think that next step is something that's what has to be. Tori, I think I'm stealing your term, but Tori framed it pretty well as like, is it active or passive work around legislation? Are you actively out there saying this is what we want? Or is it literally just, we're looking at this, it doesn't align with the shift? I guess that question of what do we do with that information, is it really just up to each individual group that wants to put that information out there? Is it more of a big council thing? I think we probably should talk about that a little bit later.
And my vision is that this is a conduit. It's a two-way street. Something that's on your radar that may not be on everybody else's, you can share. And
I think that David and I were talking just before this, and I think that the second part of that group that all your work group people came up with is that flow of communication to the health networks back and forth. And that may be like what you're saying, is like, hey, we've seen these come up. Have you seen those? They can let us know if they're seeing things come out of their particular areas. So yeah, it's a great question. And I don't have a great answer for it. The only thing that I think I know for certain is that we were just dipping our toes in the water, so to speak.
And it's a work in progress, and it's a good work in progress, I think.
I mean, again, for somebody that wasn't really around it too much, it was a fascinating look at the 1,300 bills that folks like Dave and Bill have to deal with every day.
Well, I think the neat thing too is that, my concern was that we were too reactive and not proactive enough. And once a bill's passed, there's not much you can do about it, but right. You can have input beforehand. And I think this group is a really important network in the state to be very proactive about a lot of this stuff. And we as a group may not be able to, have an impact directly in terms of testifying. The group, we say this, we say that, but you can. And
but it may be a matter of at least providing information to folks that want to do that.
Yeah.
Northeastern has an interesting opportunity. I'll learn more about mid-June. I'm attending their second annual AI conference.
Good.
But
keep going.
As I think about self-serving, because we don't have a lot of capacity, it is at least potential to be able to construct an AI agent that would allow an end user to ask a question of, here's my bill. How does this align? Where does it align with the state health improvement plan? And then it becomes a tool for people as they're writing legislation to the degree to which they think it's important to do that. It also would be public facing so that any individual who's interested in a particular bill, maybe that's the thing that they focus on, the area that they find interesting, could look to that as well. So
Another tool.
So then the SHIP document is more accessible and actionable. At a end user, anybody could look at it. You may also be able to look at a warrant article in your town and say, does this line up with this? Or how is this? So I can find out more about that from this conference. They have students available, and depending on what you're trying to accomplish, it comes with a kind of a price point. Some is somebody wants a project for a class. This feels a little bit relatively simplistic. It's not a heavy lift for an AI to create a user interface to be able to do something like that. So,
You know, you've intrigued me because there's two immutable laws in politics policy. One is Murphy's Law and the other is the law of unintended consequences. And they're both problematic. And I never even thought that perhaps that AI can, you're really starting to sell this on me. That's why I was making that comment earlier, but like, we need to have minimized both of those.
there is a, how do you say, there's always caveats. It does need adult chaperones for
Right.
sure.
Yeah.
It is, in some sense, if you view it as a student assistant or someone who's learning that needs mentorship and things like that, you're more apt to be successful with its use. It's like any technological tool, it can cut a couple different ways. So there's some caution in using it, taking smaller steps. Anytime I do use it, I look at the prime sources from which is using, and is it a credible journal? So I think it is important to look at primary source documents.
I'm going to go from artificial intelligence to real intelligence, and Anne's hand is up.
Oh,
You're on mute.
Wait for it.
Oh, no. We could do sign language.
Yeah. Jump in.
I don't
when you
know.
can.
I fixed it.
Thank
I'm
you.
not really, believe it or not, I'm not computer savvy, but I just wanted to chime in that I have found AI to be incredibly helpful this legislative season and rule change season for us. We work in developmental services. We've had quite the year, for those of you who may not know us. And we're having to create a policy here about using AI in clinical records, and there's a whole side to AI that is a little frightening. But I found using it and learning, like you said, you have to learn to ask the right questions, and then it will build on that, and it just keeps building. And then I see, it's answering. I'm like, well, no, let me ask that again. And then you reframe it, and it keeps coming back. And like you said, you have to read it. You have to check it. But it was really, really helpful on the state just handed us a new rule for certification and licensing. And I went through it and asked it some questions, took out the other one. It did a comparison. It was incredibly time saving that way. So it's an incredible tool. I would, if there's a way to get it.
I'm going to go to Andy, and then I'm going to cut the conversation off, because I think this could be a whole meeting on AI, but go ahead, Andy.
Yeah, go ahead.
Thank you.
Thanks, Scott. And I just want to add in that whether it's an AI tool or whether it's us looking as members of the council looking through legislation, I think we need to have some process or procedure of in place to recognize like where the recommendation is coming from. So for example, if we're putting an AI tool out that we're saying this is created by us, aligns with the SHA SHIP, and people put information into that pool, tool, are we necessarily agreeing with everything that AI tool says blindly? Like I think we need to have some controls in place there to kind of think that all the way through on the flip side. And I also think about that as we are going through, and I know we're going to talk about this again later, but just wanted to note that.
I think you're absolutely right, Andy, that when you look at it, it's, you want to make sure that what it's looking at is, it's almost Sesame Street level. One of these things is not like the other, where here's what the chip says, here's what the legislation says. Do they align into what, like, or don't they? But I think, running through a red team exercise so that it doesn't create stuff that you're like, hold up, that's not what I asked for. So it definitely needs to have boundaries and guide rails on it, so that if it were publicly facing, that someone can't accidentally drive the car off the road.
Yeah. Yeah, I mean, see, like Tesla's remote driving car, et cetera, like it's not really ready yet.
Yeah, let me hack into that now.
Yeah, so
Can I take you for a ride?
So I just wanted to bring us back in the Wayback Machine to our original 6 questions we asked our work groups. The first 2 are highlighted in yellow because I think we really probably exhausted those, at least in the work groups. I always think you can be talking about who needs to be involved. I don't think we've exhausted that, but we've asked that question for the work we're doing right now. And then the legislation piece we just really talked about. We haven't really talked about strategies or legislation for the future, but I'm finding that conversation to be kind of hard for most folks right now. And there may be another way to kind of dig into that. But what organizations are doing the work and what we should highlight has been, as you'll see, a hot topic. And then really what should we communicate about the domain is kind of turned into what should we really be focusing on and then talking about it after that. So, and then, Whitney will take us to a little bit of what's happening with, and I never know, is it Go North? Is it Rural Health Transformation? What should we actually?
It's both.
It's both.
Well, Go North is the unit that does the work.
Okay, all right. So it's okay to say it's a Go North update because it's your work.
Yeah,
Yeah,
sure.
all right. Okay,
I'll respond to either.
Yeah. That's just,
And others.
it's like Megan Heusler or Husler. She's going to talk either way. She's actually got a great personality. So I wanted to I feel remiss. We don't talk about the leadership work group because they do the behind the scenes stuff around agendas and our overall direction. But I just want to give a shout out to the folks that do this. This is yet another meeting. Several are on multiple committees. And I really wanted to just highlight Lauren for a second because during our last work group meeting, we were talking about this potential of highlighting work in SHIP champions. She had a really, I thought something we would just absolutely can't lose track of. And I don't know if you want to speak to that, Lauren, if you're still with us.
Yes, thank you so much. One of the things that I mentioned is at the consortium, we serve as the North Country Public Health Network, and our board is comprised of many of these champions that are already doing this work. And I know several years ago when we had the marketing tool, it was really framed at trying to market for new champions to be a part of this exciting work. And one of the things that our board mentioned is that they're really already out in community. So kind of reshaping that narrative, I think there's an opportunity there. Is that what you're referencing, Scott?
Yeah, no,
I know we talked about a lot of different things in the
It's
meeting.
okay, but that's precisely it. And I thought that was a really great reframe and nothing against the people that created that SHIP champions thing because it was a lot of work. Because that's what you want to do, right? You want to get people involved in your organization. But I thought it was just a simple reframe. And I think it's so timely because people are just stressed out and they don't have a lot of good news. It's like just highlighting the people already doing the work and bringing them into the fold rather than saying, go out and become this champion as another thing for you to do when you've been doing, I mean, Lauren's talking about, nurses and other folks, they've been doing this for 30, 40 years. And, here we look at Anne's getting ready to go off into the sunset and, with her 40th year, it's like, she doesn't need to be a champion. She's been the champion long before there was a SHIP. So yeah, thanks, Lauren. It was just I don't want to lose that point when we talk more about that. So here's our access opportunity, folks. They talk about a variety of things, or they come from a variety of backgrounds. They talked about the same things everybody else says right now. They've held 3 meetings, great great attendance. I mean, that's one thing I could say about this work group. I did peek back in our work groups last year and we started off really well. We had about 7, 8, 10 people. But by the last meeting, I think we were having about 3 or 4 out of the 7 or 10. So these folks have maintained great attendance and we certainly appreciate that. So Jess, I know you're here. I don't know if you could just, that you had a comment about what we should be doing as far as learning more about the regional public health networks.
Yeah, absolutely. Happy to jump in. So I know as a work group, we talked a lot about really how we could begin to establish more of a connection, more of a relationship with regional public health networks through utilizing some existing connections that, the group may have already have through our work outside of the council. I know quite a few folks already do work with the regional public health networks, which I know, I believe Kathy will talk a little bit more about, so I won't get to the weeds on that, but essentially utilizing the relationships that many of us have built over time to grow that relationship specifically with the council. We also threw around the idea of inviting different networks to come in and speak to the group more about what it is that they do on the day-to-day. Everyone in the council, I think, has varying levels of understanding of what it is that the networks do. So we thought it would be really smart to maybe invite some folks in to share more information about, things that they're working on, as well as hear about some of their ideas for collaboration and just in general how the council can best help their work. So I think that's a general gist of what we discussed, but if anyone else has anything else to add, please definitely jump in.
Thank you, Jess. That was perfect. And Kathy, I know you had just mentioned what is your connection to your group?
So our public health, it's Winnipesaukee Public Health. They operate a monthly meeting and try to get area partners to participate. It's held at the Concord Hospital. And they just bring different things that are going on in the Laconia region together. But we have also partnered with them. We operate a home health agency. So they provide CPR training for us. They've done vaccination clinics for our tenants. So we try to interact with them whenever it comes up to anything that is health related, and they can help us with that.
Thank you, Kathy. Perfection. And I know it's not finished yet, Tori, but just a little bit about that work that you're doing with crosswalks with Ship and Ship.
Right, thanks. So the New Hampshire Public Health Association is also working to connect more closely with public health networks, knowing that we're hopefully able to offer some support around coordinated language and some tools and resources that can be helpful. One of the things we've done in that direction that should be ready to share with the SHIP Council, hopefully by the end of today or beginning of next week, is a alignment and analysis of the most current community health improvement plans that the PHNs have generated and the SHIP. So looking at those spots where there is alignment and where there isn't, and there was never an expectation that there would be. So this is not an evaluation of the CHIP's abilities to align, because that wasn't ever an expectation. So it's more of an exploratory look at what are the CHIPs looking at, how are they looking at it, are there any spots where there's already alignment, and also looking at expanding that alignment check to the some of the more local and other regional plans, like the Regional Planning Council plans, and the statewide plans like the State Plan on Aging, the Governor's Commission on Addictions plan for their work. So kind of eventually creating a snapshot of all of the different plans. Where is there synergy? Where is there more concerned about where there's diversion? And is there any value in looking at that for the SHIP Council to think about, are we missing anything? Are we missing anyone? And are we seeing any big golden opportunities jumping out? So
Yeah, Tori, she covered the next bullet too, which was, should we learn about those things? And actually, that's fantastic. How long have we been talking about having an idea of where all these plans dissect? So that's amazing. So Martha, I'm sorry, you haven't heard it for a while.
Oh, I just wanted to connect with that regional public health. We work very closely at New Futures with the regional public health networks on advocacy. We provide training to all of them. We meet with them pretty regularly. And they have really stepped up to the plate on getting information out to their coalitions. So most of them have several coalitions that work in the different issue areas. And so I just wanted to put in a plug that they do a really fantastic job around advocating for bills around public health related. You know, we have 7, maybe 8 areas now, issue areas of public health that New Futures works in. And the regional public health networks are like our go-to people for that. So I just wanted to say that they're a real huge help getting information out, getting people to those meetings, getting people to advocate on different public health things. But so I just wanted to make sure that was.
I appreciate that. That information is what we've been talking about, right? How do we get information for? So thank you, Mark. That's perfect. I don't think he isn't here. I'm sorry. Go ahead. Excuse me.
Tori, I wanted to thank you for that. Like, we did a crosswalk between the Governor's Commission and a number of other things on drug addiction. And I mean, that is unbelievably helpful. And, you know, part of it's like, you know, seeing what we do have, but then seeing what we don't have and what we need to have. I mean, the information we got out of that has dictated exactly where we're going to put, you know, that $330 million. And without that, I think we would have been floundering. So thanks for doing that.
Yeah, and it really helps with, I think, future SHIP efforts when you talk about 2028 when you're redoing or editing. It's like you start to see where some of the momentum is. You don't want to lose that. So yeah, Tori, great work as always. Dee is not here. She had just put up this gentleman by the name of Sean Collins, who does some great work up in Plymouth. We did talk a little bit about a SHIP champion criteria, but nothing was really solidified. And then we asked a question about highlighting a legislator or legislators that are supportive of SHIP, and then we'll talk about that in a second with the next. Health status and outcomes is our biggest group. They are a little fun to work with. They, again, 8 out of 10 folks. They're the most. They've met the most because they were first, of course. It is if anybody wants to join that group just for fun, it's actually quite a hoot. So Monica had talked about an outreach for bills and when in the process we should do that. Do you want to talk a little bit about that, Monica? Where's Monica? Not here, I forgot. I don't think Monica's here. Anyway, so that basically, I know Dave and I talked about this like before the meeting, but it was like if we're going to reach out, when in that process should we do it? So there really wasn't a specific answer, more of another question for us to kind of ponder. So Molly, do you want to talk a little bit about your comment about the lobbyists? Unless you retired early, and I don't blame you if you did.
It's a really good idea.
Sure. Just that in the meeting in which we were talking about reaching out to legislators, someone had suggested that we interact with lobbyists as a group or invite them to come and share with us what their significant issues are and what we would seek to support going forward. And my only comment was that in order to get a list of them, the Secretary of State's office does require all lobbyists to register. But I don't know if there is an email list to all lobbyists. And I think we might want to do a little bit of culling if that was something we wanted to do. And just one other comment about lobbyists in general. And I think anybody who's been a legislator or is one has heard this in one form or another. I had previously been very skeptical of any and all lobbyists before I served in the House. And an outgoing senator said to me, just remember, they may be the most well-informed people about a particular issue, but they're all also representing a point of view. And so as we learn from lobbyists or seek to inform lobbyists, and just recognize that they are representing particular interests. So take take what they have to offer with a filter, I guess.
I feel obligated to follow up on that because, for most of my, no, this is an amazing comment. For most of my career, I've been an advocate. I advocated for the rights of people that were vulnerable. And I did a lot of lobbying based on that, for which I was never paid a penny. Usually it cost me money to do that too.
We call that advocacy, right?
Exactly. So, you are still a lobbyist when you're doing that. And that's the hardest thing about becoming a legislator.
You're a lobbyist once you tell someone how to vote.
Yeah.
Up into that line, you're not a lobbyist. That is.
I was definitely telling them how to
That's
vote.
I'll just say that's the red line.
He was an unpaid lobbyist.
That's why I use the term, but like, there was the hardest thing about becoming a legislator is technically I'm no longer a lobbyist. And I couldn't be that micro, in what I did and what I saw, but I at the same point, these people are like really, especially the people that aren't being paid to do it. There's just something special about them. But at the same point, I learned a lot from the other folks. And like you say, use it as a filter and get a variety of opinions. And if you're not, I don't know, Dr. Woods likes to say this, but if you're not there, you're not at the
table, you're on the menu.
That's it.
Oh, welcome.
Yeah. And the lobbyists have a way of allowing you to be on at the table in ways that you can't be otherwise. So they do have value. But at the same point, you're right. You need to, be open-minded and somewhat skeptical.
I think it's important that from the lobbyists, that awareness, to make sure that they're aware of the SHIP document, I think is important. It gives them something to reflect on. But I think that's a great idea.
Just an awareness piece, yeah.
Yeah, it's, I don't know, whether they're aware of, there's a state health improvement plan document, and as they're doing their work, are they working towards achieving it, or are they working on things that will erode it?
I think it's a good segue, and I don't want to get too stuck on this because we're going to talk about it in a second, but it's been brought up by each group. And I'm not sure, please, anybody can comment. I hope that you would. I'm not sure it means that the work that they feel like they're doing right now isn't particularly effective, but there's been the question, like we've had our 3 months, thanks to Tori, we did a 3-month pilot. Everybody's had 3 or 4 meetings. Is this domain, I'm not a big fan of the word domain, but is this kind of domain work group set up the way that we want to do it, or should it be more organized by work? And that goes to the comment of really all the previous people that just talked about public health networks, which would be its own kind of committee, and all the people that are talking about legislation, that would be its own committee. So you'd be doing that work that you really want to focus on and have some skill around, rather than kind of looking at it from, and again, I don't want to get caught up, but that is a question I think we have to take on now that we're really at our 3-month, we've done our 3-month thing with work groups. So I won't belabor that, but it's something for us to be thinking about. And then Polly did suggest reconnecting with Senator Rochford, who actually is a SHIP member, because of his work around the HHS committee. So, that might be something for us to think about.
I can do that. He and I talk somewhat regularly, and I keep mainly.
No, it's okay. I think it's just maybe, and I think that, again, we're doing the work around the legislation. I think he will be helpful as far as how can we be helpful.
I've been really impressed with him because, we had a very negative start because of one bill, his term in the House. And I think it was a learning experience for him. So you never want to blame somebody for making mistakes while learning. But I think he learned a ton from that. And he's brought that to the chair. And what I appreciate for him is his willingness to look at both sides of an issue, which is kind of rare these days. So that's really important, but I can reach out to him.
Yeah, I think it's, and again, whatever these next steps we'll do around the 3 big pieces we've come up with, I think it would be important for him to be there, for that. And Bill has done great, working with legislation too. So
I just want to say one thing, these senators are on a million committees and they're very busy. I don't know how they do it and have a job, because he actually does have a job.
Yeah.
That may be part of the problem. He may be, I don't know. I just noticed the committees that I'm on, he doesn't come to, and I
Well, I mean, I
kind of
think
wonder if he
It's a good
feels.
question, but I think it's a valid point for, and really for everybody on this council. And I think of Polly's like 7 years of work and coming to these groups, and she does work group. And so it's like, maybe being at these meetings isn't his job as a member, but maybe he finds a way to help in other ways. You know,
I mean, yes, yes. And some of it's like, well, do you think there's a legislative gap in this committee?
Right.
And if he sees there's not one, because like he's on the opioid abatement commission with me and another commission, he never comes to any of these meetings. He came to this one once, he came to OAC once.
Yeah.
And I don't know, he and I are friends, so.
Yeah. I mean, I think again, just having that connection will help.
If he came like once.
Yeah.
Every so often, that'd be enough.
I mean, you can, it's good to have, that's why it's good to have you here, to have those connections and build.
And then this is the other thing I found too from meeting groups is that if you're not there all the time, you kind of feel like you're not part of it, and the less you
Right.
go, the less you go.
Yeah.
And maybe we should just, I should tell them that, you know, if you come once, you're
so
incredibly valuable.
I mean, I have to say, I value everybody that comes anytime. I mean, it's not,
right.
I'm the only one getting paid to be here. Well, anyway. Whatever. But so, I mean, it's the fact that you all show up, continuously do, it's pretty amazing. I won't go through, we were just asking for examples of ship champions, and Bill brought up Jessica Montaigne as a representative, has been doing some great work. And then there was I'd like to hear more about this. I know we don't have a lot of time because we're running out of work group time, but Bill was talking to us about a Sullivan County initiative where they're recruiting high school students and training them as like LNAs, and then using it as a pipeline to try to, you become an LNA, you work in LNA for a while, now we're encouraging you to be the RN or LPN or whatever it is that your next step is. And I thought that's exactly the kind of thing that you'd want to promote, because it's something that more areas could do. So I don't know much about it, but I'd like to know more.
It's a huge issue and it's really important, and it used to be a normal thing.
So we piled two groups together, and much to their credit, they never complained. Well, it's one less meeting, so that's helpful. So as separate committees, they've met twice, and then we've had one combined meeting. Most everybody was there. There's a theme here. People are showing up when they're supposed to, which is pretty cool for volunteers. And they have a lot of area to cover, obviously, with two different domains. So I thought it was interesting. Tricia, do you want to speak to that comment to your comment about having more access to legislators?
There's already a little bit of talk about the public health networks, and we definitely work with New Futures and have support from the New Hampshire Charitable Foundation. But I do think that one of the benefits of creating relationships with this group and the RPHNs could be having more contact with legislators. I think sometimes it's just a little bit intimidating, not totally sure who to talk to, how to talk to, what exactly to talk to. Like you guys mentioned, over 100 bills, and there's a lot going on, and this isn't the area of expertise for a lot of the staff of the public health networks. So I think if this group had very specific calls to action, like we've looked at the CHIPs, we've looked at the SHIP, we know the legislators, we know the bills, this is what we're asking for community support on, the RPHNs could be the conduit that then reaches out to their work groups, their public health advisory councils, their networks, to say these are the very specific calls to action, because sometimes it just feels too big from my perspective. So I think that could be a really nice alignment with this group and the PHN structure.
Well, you're definitely right. After looking at 1,300 bills before taking Ed's comment about AI, I'm with you. It's massive. And then your comment next about the willingness to do that.
Yeah, I do think we'd be more than happy to share. There was those comments about the SHIP champion and that kind of work that I do think we're often looking to celebrate folks that public health is really hard, and it's decades, if not generations worth of work. And so some folks just kind of get lost in the sauce, and it can feel really defeating. And so opportunities to connect and provide examples. And I do think having clarity drives engagement, and being part of something larger drives engagement. And so being able to think about a project that's happening at a library in a rural town that's impacting the SHIP, it just gives that more sense of belonging and purpose. And I think we could help tie those dots together when other people don't even know those dots exist. They're helping accomplish the ship, but nobody's ever told them that before. And so
Yeah.
how do we put that together?
I think that's really a very cool statement, Dave. I'm sorry.
I just want to address something you said earlier, like, and this is from personal experience. I mean, the best thing I ever did was take a course at Georgetown on congressional operations, which actually got me into legislators' offices to meet with them, to learn how to interact with them, so on and so forth. And I'll be honest, before I did that, I was scared to death to talk to these people. And I think and we noticed this, there's a lot of fear. And I'm curious if you guys thought that it may make sense to have some sort of training session. And I hear this from people all the time before they testify. They're like nervous wrecks, you know? And would it make sense to have a training people for the Public Health Network people on how to interact with legislators and stuff like that?
I'm gonna let go.
New Futures does a great job of that already, so I wouldn't want to duplicate anything. So New Futures has kind of like an advocacy 101 and advocacy versus lobbying and how to navigate the state Gen Court website. And I think it's just that experience. And we try to do like legislative breakfast and other opportunities that it's really just that meet and greet. And then learning from legislators when is the best time to do that. And then trying to think about like summer or the, New Year's season, that there's no bills to talk about. Like we don't yet know, we're not lobbying for anything, but like I just need to get to know you as a person so that when a bill crosses your desk and you're like, I have no idea, let's reach out to the Public Health Advisory Council in the Monadnock region and let's ask them what they think, instead of being like, I'm just going to vote because I don't have enough information, or some way that we want to be a resource, that legislators look at a bill and they're like, I actually don't know. And they have trusted relationships with partners to reach out and say, what do you guys think? Kind of that two-way communication.
You are correct. They do a wonderful job. I actually just spoke at one of theirs and it was fun. It was a good thing, I think.
Whitney has a hand.
I was just gonna add, I think there's existing training, which is a great tool. I think being specific on the asks, because again, like sometimes it's like you want to do something, but you don't even know what is that step to take. But then the third piece that I was sitting here thinking about is I didn't get any formal training, but the best way that I learned to go and testify at the legislature was to just go. And like you can go and sit or you can live stream. And like I was sitting thinking, there's a number of people on this council that do that and have that experience. And in some ways you could almost have like a little buddy system, like, hey, I'm going, anybody want to tag along? Because once you see it, it's not nearly as intimidating. Like I brought my 8-year-old and she was like, this is it?
Well, the other nice thing is they're not allowed to be mean.
And they
Like when you watch the testimony in Washington, they're mean.
Yeah.
They're not allowed to be mean here. And and they get reprimanded if they are.
But I do think it's a great point, Tricia, to redirect us a little bit, that, Martha was talking about that earlier, about the trainings they do specifically with the networks. But I think, Tricia, you were talking a little bit more about just connections. And a group like ours, and I think we talked about this earlier, just helps to make connections. Did I get that right?
Yes. Yeah, I think the power of relationships, I think we all know it in our core, and it's easier to write a white paper or plan something else instead of picking up the call and having those coffee conversations or inviting people. No bills are on the table. We're just trying to know each other as humans. You live in the same town as me. You happen to be my representative. Being able to have those conversations when we know it can get a little contentious. Maybe we're not going to agree on everything, but maybe we'll agree on the environmental things and not on the vaccination things, or we will on the transportation and not on the childcare. Like, that's great, but like some way to have those connections. And New Futures does a great job with like letters to the editor and other things that they will help. And they do tours and they do that kind of hand holding that was just explained, that like go on a tour, sit together. I had somebody from my team provide testimony and they helped with the prep. They helped go, they walked over together, they sat together, they were with her the whole time. So all of those things are on the table, and I think we would be remiss also to assume that everybody knows that these resources exist. So I don't want to recreate the wheel, but I think promoting what New Futures has to offer could also take us far.
Not that we want to sign Martha up for more work, but that's a great thing of just having more people know about what's available. And that's for a group like this, that's actually a primary function of just getting the right information in the right hands. So I know, Andy, this was not a huge comment, but it was a great, I actually needed this feedback. You want to talk a little bit about your idea here?
Yeah, I was just suggesting kind of around having some structure about how we think about the ship champions, and I think it's a great opportunity to build momentum around some of the specific strategies. And I think this group has the knowledge that if we sat down, whether in our work groups or just took some time, that if we went strategy by strategy, I think everyone could name someone doing some work related to the strategies in the ship. So just thinking, and then if there's not, where are those gaps, and highlighting that there a gap there. So just a suggestion on how to frame how we think about this and bring folks into the conversation. Because again, I think that's one asset of this plan, is that it was meant to be really inclusive. So I think, again, just an opportunity to highlight a lot of the different work in the state.
And I think the reason I talked about feedback, Andy, is because I was asking groups to come up with, ship champions with just expecting they were going to look through a 12-page document and find it. Whereas like both Andy and Polly were like, can we get a simplified version of this so we can just scan down and see? That's our first scan. It's just like, does they fit any of these particular categories? So I appreciate the feedback because I think I was making their life harder than I probably should.
Well, it's even similar to the document sent out about does this align by the strategies? If you just change those align, doesn't align columns to champion and description of the work, like we have it right there,
Yeah. No, that was a great suggestion. That wouldn't happen without you and Paul. So I certainly appreciate it. Martha, I don't know if you want to talk a little bit about this idea, because it's one of those things that didn't really fit into a category, but I wanted people to be able to hear your comment.
Yeah, just that, in terms of the public health work, we have we have folks working on policy, and they are all lobbyists, by the way, that have experience in public health, many years of experience in public health areas. I mean, Kate, I always use Kate as the example because she really works in the more traditional areas. So, the vaccine, the substance use prevention areas and all. So just, I think we could be a resource for folks. I would encourage you to go to our website and sign up to get emails, which are really the action items that we do. So that can be helpful for people. Not that there aren't other groups doing some of this work too, but we could do that. And we can, if you have groups that you want us to do like private training with, we can do that as well. And then I do have to go to our legislative weekly legislative staff meeting in a minute here, but I wanted to just mention that Tricia had talked about so many great things, but wanted to lift up really around the off session time period to build those relationships. She's right on about that. That's like the most important thing that you can do in the local community, is to build relationships with your local legislators. We can help you do that if you want us to, by helping to set up meetings with them. But this is an election year, and so you sort of turn from that to actually helping to educate people. There's usually like a third of the legislature turns over, so it's really important for all of us to get out and educate those new people coming in. And all that means is just set up a coffee or breakfast or lunch or whatever you want to call it, and invite all the candidates that are running on all sides of the aisle, and invite them in and have some of your local folks talk about the work that they do. And that's like one of the first steps in building that relationship and offering to be their, local contact if they need information on things that are going on or impacts on your community. So building relationships, I just wanted to say that was important. And
I want to make sure I send out with the meeting minutes, send out some information on what you're talking about. So I'll connect with you.
When you do things like invite people during campaign season, there is a sensitivity and actually some legality around. Right. You can't cherry pick.
Right, exactly. You need to invite everybody on all sides.
Yeah, yep. I've seen one nonprofit do that. It didn't end well for them. But yeah, you do need to invite. Interesting when you look at the ship champions. Interesting way just to think about throwing on a parking lot is we have 400 House reps and 24 senators. They live in places with people who do things that are consistent with the ship. Is that an opportunity to actually get them actively engaged with the ship when they go back to their areas and go, give us just one. Like, we're curious when you look at your community, who do you see? And here's the filter. Look through this filter and find us. And we're just asking for one. If you got more, that's great. And then it's what is that recognition? Is it something that can be placed in that person's establishment? It's like the Better Business Bureau or the we're a Healthy People 2030 champion. So healthy people have criteria for making that true. When you think about inclusive, we've got like 1.2 million people. If they each did something, it doesn't have to be running a marathon or something, but you could do something at a hyper local level, and they should smile about the fact that they're establishing a free food pantry. Right. Fits well within the ship because it addresses food security. That's just.
I think it is a fascinating way to go about it. You're asking them to actually promote people from their own jurisdiction.
I think they would want to do that. I would think that would give them some sense of connection, some pride, a reason to go interact with their community of, I don't know, I've never really thought about this before.
And again, I don't mean to keep belaboring the governor's council work, but I will tell you, that's exactly what happened, and it was very much a feel-good situation. I never received a single complaint about that work, and I can't say that about anything else.
Gratitude is cheap.
Gratitude is cheap. I don't think Shirley's joined us. She had just a couple of really great suggestions for people that have been doing a lot of work in the state. Oh, sure, go ahead.
Yeah, sorry. Yeah, so I know that Trisha and Andy and Martha kind of touched upon the need to kind of focus on key players missing from the table and highlighting organizations. I think that we at SHOSHP kind of have the distinct opportunity to kind of elevate organizations and bring visibility to those that are underrepresented and kind of strengthen the collaboration like we were discussing earlier. So some areas of priority areas that I have noticed while the work that I've been doing has been in maternal health and there's opportunities there, I think, to target engagement. And one organization that's doing that is the New Hampshire Perinatal Quality Collaborative, which is a statewide initiative led by Dartmouth Health. And so they're doing a lot to promote safe, equitable, and respectful care in the maternal and infant health. They have like 11 coalitions across the state of New Hampshire, really doing some phenomenal work there. So I thought that was important and engaging some additional like elected officials. Someone that came to mind for me was Representative Mary Georges, and it's her first term. She's a first-term member of the House, and she has a strong connection to the immigrant and refugee communities, and she's rooted within her own personal experience, but she's also executive director of an organization called Victory Women of Vision that supports immigrants and refugees adjusting to life in the U.S. So I think that she can really bring focus on family health outcomes and how we can serve some of our underserved populations and really have a community-informed policy perspective. So those are the two things that I talked about.
And I think it's important for us to remember that Shirley had been filling in admirably for Ruben when he was out, but we just didn't let her go for the committee. So thanks for sticking around because you really are a fantastic addition to this group. But it's already a great group, but we're very lucky that you stuck with us and didn't disappear. So thank you, Shirley.
Thank you.
Yeah. We're going to go quickly. We're not going to talk about block grant too much because I don't want to. No, that's not true. So these are our three big things, right? And I tried to keep it they're probably a little more detailed than that, but just a big overview. And we've talked about certain ways that we could do this in the updates. So advising, something to do with policy initiatives, pieces like that, all the feedback we've just gotten. Then we have that middle piece, which is both highlighting the work in a SHIP champion's role And then really just how do we align, how do we better work with RPHNs? And then lastly, it falls a lot on Whitney and I think in a lot of cases is how do we align, do a better job really of just, and block grant is one of those things, with what the ship has within it and what we're doing in our initiatives, our contracts, et cetera. And also, which I know Tori and Polly had commented on as far as, it's not just the state agencies, it's also, again, those state plans, those, the Commission on Aging, et cetera, et cetera. And Tori's doing this work, which is going to really help us, I think, try to figure out where all this lines up. So my question really for you is, and I just want to hear any and all thoughts that you have. We've worked in domain work groups. We have 3 of them. From Comp Cancer, my work with comprehensive cancer, everything was in 3s. So I don't know why that was, but we had to have 3 initiatives. Everything was a 3. So we had 3. And we've answered kind of the same questions out of our 6. But the biggest thing I think we want to get across now or just learn more about is like, do we focus more of our work group activity on these 3 things? So you would have a work group on legislation and policy and, people that really want to dig into that. I mean, you think what a great, we have Dave and Bill and Martha and, Polly's leaving us, but I'm sure whoever's coming on for Polly will have some experience. You have that work with RPHNs, which we've already heard people have such great connections with. And then you have me to start with, working with kind of more of the state agencies and pieces like that. Now, I will tell you that, and I want to thank Tori who put us on this road. Without it, we wouldn't be having probably a meaningful conversation at all. Who's got us back really facing the ship again and working with it. So those domain groups have been great. They really have. But is it time to reform those at our 3-month, this is kind of our 3-month evaluation meeting. Is it time to work more, dig into these 3 things as work groups, or should we do these three things in the same work groups we have?
That last one feels like this is going to sound bad. Give me AI and a day and I'll have it done. That's not hard.
I think it's a great point. And
Now,
I think the language is done, but so some people may not know, this is actually my first official day as a ship hiree. So I'm not a member, don't get me wrong. I'm still not tall enough to ride, but I am now official as your helper. So I also am supposed to be running this block grant or administrating this block grant. And I also am supposed to work with the facts a bit. So, which is the Public Health Advisory, I guess it's councils, not committees, but so each public health network has them. So I am in kind of a unique situation being all 3 to help try to make these things kind of mesh a little bit better. Because Ed is right. It doesn't take 5 seconds. AI would come out where we sit and where we don't sit. I will tell you right up front, in the blog grant, there's probably 1 or 2 things out of 13 that actually fit the ship directly. It's a lot of.
You wouldn't expect it because if you don't do it by intent, you're not going to get it done by accident.
And I also think that, I don't want to belabor, but I also think, again, if you're trying to keep the health department running, there's lab and there's salary and all these other things that really don't directly mesh. So,
but I would think that if the state health improvement plan should be an overarching document that everything else should be subservient to.
I am going to say it should.
The cancer plan is a subset, a very important subset, but it lives inside the ship for a variety of reasons. And you could think a lot of the area of the ship either advances or detracts from oncology, from prevention through treatment. And I really love to see if I'll look to Lauren for to be the front runner on this with my help is, it's silly that the CHIPs aren't, the state health assessment questions should be the exact questions the community health assessments are asking. If you want to ask more, that's your prerogative, but you shouldn't ask less because it's ineffective and inefficient to not have them line up because everybody lives in the state of New Hampshire first and foremost, and secondarily in counties, and then tertiarily into towns. And it all should roll up into a nice little package. You can put a bow on it. Now, the consultants will not be happy with them because they want to make money, and they do. when they create things that are solutions to problems we didn't have and come to it and sell us a community needs assessment because some consultant wanted to make money. So I think the state should actually drive, the SHA should be the community needs assessments.
Well, those of you that were around last year.
Fiat.
Right.
Not by choice.
Those of you who were around last year might remember Palmyra actually from Breakfast suggested that well, you might have said it first and she might have repeated it. I'm not sure.
Yeah, it wasn't her thought.
Yeah.
But
again, this was said publicly.
She forgot she was a guest in our state. And I helped pack her bags.
Right. So anyway, there was a comment that was made before about, and maybe that is something, a lot of these things for long term. I'm not going to promise I'm going to turn the state barge around in a few days, but these are things that
they feel like tasks, not work groups. Yeah. These are like time and scope limited activities, not the work groups have a lot.
And I don't disagree. I think the thing is, yeah, and that's what we're asking folks is it really, do we get very specific? We've got a hand up and I don't see who it is. I apologize.
Hi, it's me, it's Andy. I just wanted to chime in to your original question and say that I value the expertise in each of the work groups by domain to make sure that populations are represented. Like, for example, older adults, we have experts that are in healthcare delivery. So I think organizing the domain work around these three questions is beneficial to make sure that all those perspectives remain represented in the work, but that's just my opinion. To throw out there and get any thoughts about.
I think that's, and I think you just completely alliterated better than I could as far as the reason to stay the same. The only challenge I see is somebody who just, does all the scheduling and tries to combine it is we would just have to come back to this group and everybody would have to report like we do now, report on what's your legislation piece, what's your highlight piece, what's your, and that's not, hard to do. It just takes some organizing, but that's just one byproduct of having it that way. Anybody else?
So I'm putting Scott, some thoughts in the chat, but I'll reference them real quickly that I agree that there should be alignment. The plans should inform each other. But I also think that they don't all serve the same purpose or the same function, and they're not all work plans for discrete organizations with a hierarchy where the contracts are specific about the delivery of the work, and it's clean and simple and easy to make the decision analysis about how to write it so that it reflects the findings in the SHIP, like who decides what degree of fidelity there should be, because there's this much funding, but the CHIPs also support other organizations that aren't funded by the state. So I think it's complex, and I think the SHIP Council is the right entity to have this conversation. And I would also suggest that maybe part of that conversation is that the CHIPs and the other plans might inform the SHIP, and right. That it's not that it's not simply yep.
So I know you and I have talked about this before, but I so appreciate that comment because it never really made much sense to me that I really like the process that you all did. I mean, it's amazing. As we've talked before, the SHIP was always DPHS just vomiting up some things, and that was the end of it. It wasn't statewide. But you pulled all these folks together and created a plan. It's an amazing thing. But I also was always fascinated why these things were being written by every region, why there wasn't some at least that bubbled their way up into and maybe there were, I just don't see them directly.
No, I don't think the community needs assessments are a statutory requirement every 3 years by critical access hospitals. It's almost unfair to ask the critical access hospitals to do this, and why it's unfair is critical access hospitals are designed to save your sorry ass when you're about to see St. Peter in the ED and help you get back out of the hospital so we don't bag and tag you. They're not designed to do anything in the community. They have the wrong staff, they have the wrong brain trust, they don't have the funding to do things inside the community. So I think it's cruel and unusual words on the 8th Amendment violation to ask them to do this. But someone in the Secretary of Charitable Trust decided it was a smart idea. So if they're gonna do it, they can't do all the lifting on their own. I don't have a horse in a race. I don't work in the hospitals. But the community needs assessments, I've been there for 20 years. Nothing's changed. We should just stop doing it because the health and wellness in the county of Coos has seen zero statistically significant increase in anything of any p-value of 0.01. You know, give me a UNH student to do a chi-squared analysis, we'll get the same result. So until we get those community health improvement plans in the hands of the people, well, the hospital is saving our sorry butt, but everybody thinks somebody else is going to do it. It's somebody else's job. It's the person who lives on Main Street and Turner Street's job, and the person next to them, and their friends and their families. This is 102 million people state need to take some level of accountability for the fact that they eat, sleep, breathe, and procreate. Because ain't no one else is going to care unless they start caring.
Yeah, and I think again,
When I get off my soap.
No, it's just, you could stay on there. I mean, you're taller than me without it. The whole point is, I remember when I was gonna potentially do this about a year ago, it didn't work out that way. We were doing other things, but we were looking at the blog grant, we were looking at the public health advisory councils and again, looking at what two different consultants had written up about the problems within the networks. And, you know, in full honesty, there was a pretty large section that was, you know, the state of New Hampshire is not helping us. They're asking us to do too many things with not much money and too many plans, and the work plan isn't planned. And so, I mean, I think we as the state have to take a certain ownership too. And so we'll see, you know, where that goes.
So does every single resident. I mean, that for me is I understand life is not easy all the time. Yeah, but it's really friends, family, and neighbors at the hyper local level who do the meaningful work.
So I want to thank Andy. That was a great comment. Any other thoughts about structure? I know it's not a sexy conversation, but it's fairly important, at least from my standpoint.
I just want to make two quick comments. Well, the one's quick, one's not, but, we have three groups now that are not mutually exclusive. They overlap a lot, but they still have, represent very different perspectives on this. And I really like the concept that they stay and use this as their.
Okay. Yeah.
And tell me if I'm wrong. Unfortunately, there's scheduled times I can't go, but so I haven't been involved, so I don't really know what's going on there. But that's my impression as an outsider, is that I think that having them look at these issues from their individual perspectives, bringing it back to the whole, has a lot of value rather than this is a legislative group, this is a public health group, this is that. I think you need to look at these three perspectives within that domain.
Which is kind of what Andy was saying, and I guess I know we're going to turn it over to Whitney and Peter pretty soon, but just one last thing, have people that have been doing the work in work groups. We're at our 3 months. Are they feeling like this structure is working? Because we're really talking about continuing the same thing without our original 6 questions and just moving this work into each of the domains. Are those folks that are in those work groups okay with that?
This is where I say not everybody. Really sorry. It's like a Sherman's thing at line.
It's okay, and it's okay if you don't have a thought, but I'm really more curious if, again, this is that point when we're, do we flip things over or do we kind of persevere? So,
and you can use that in your next meetings as a point of discussion.
Yeah, we could. Yeah, I think that's probably good. Yeah, so people can reach out to me privately if they have any strong thoughts, but it's a good segue because we've reached exactly what point.
I just wanted to say one thing to build on what Ed said. This has really pissed me off. But it builds on what Ed said. So there was a bill on the trauma commission that the Republicans killed, and that was a nasty thing I just said, but it needs to be said. And what I loved about the commission, and this builds into what we're talking about here, was that if you looked at the commission now, it was composed basically of neurosurgeons, general surgeons, this surgeon, that surgeon, and under the point of view that the treat of trauma was only a surgical thing, which is totally not true. And so what the point of the legislation was to change that, to make it more whole person, whole life, and include everybody in the conversation. And they voted that down, which really blew my mind. But what I'm getting at with that is 95% of healthcare does not occur in a doctor's office. And it seems counterintuitive to me that some of these health networks would be run by a hospital. Yeah, they're an important player, and they get involved in the conversation, but when we don't include everybody else, then the whole system to me falls apart. And maybe it's exactly what you said, is everybody's looking to the hospital, they're not the right people, and
I don't think it's fair, because it's not how they were designed.
exactly.
And they have a seat at the table, have an important role to play. But sometimes I feel like they become the dumping ground for everything that doesn't work in the health community, and you go fix it.
Well, I worked as a teacher and I worked as a nurse. And I will tell you, they're very similar. Like, it's like all the things that nobody else wants to do, they kind of are handed to those two groups. And so I agree. I think it's tough. The hospitals are having a hard enough time with it already.
Well,
I don't think we can do more.
I mean, I've been to a couple of public health network meetings, and I really enjoy them. But the one of them was definitely very hospital driven, and the hospital in that community and that network's very strong. But then, the other one, the hospital's totally failing. And what was really neat was to see all the entities within the network really rise up and take ownership of the public health in that area. So I saw two very different worlds. And I was a little, I saw the latter one first, the other one second. And I became resentful when I went to the other one and I saw the hospital kind of running the show. And I just said, I don't think that's the way it should be. I think that you're a person at the table, but you shouldn't be running the show. And I kind of feel that way about here too, is there's no one person or group that's more important than another, and we all have value. And anyways, I really appreciate what you said, Ed, because I think that was really important.
Individuals in the community are doing great work. I think that's part of the point. Like, we need to shine a light.
Yeah.
Because you can each go into your own communities. I bet you could find 3 different individuals, organizations who are focused on housing or food security or caring for people who are aging or childcare. There's really great work being done at that hyper local level. And they're just doing their thing because they just pick what they do. That's what they do. Yeah.
Well,
all right, I don't want to go too far because we've got a couple of guests, and we brought Peter Ames into his own room. So we thank you very much, Peter, and give us.
Yeah. Oh, yeah.
But again, I mean, thank you to Peter and to the staff here. They've welcomed us, given us everything we could have asked for and more. And so just before we start, I just wanted to thank you.
Happy to have you anytime. Thank you.
I'll let Whitney guide us home.
Can I just do a check? Because I'm
Oh, you want to check?
brain. How much time do we have? And
You've got until about 12:55.
okay.
So that is about 30 minutes.
Okay, I will not even come close to taking that, so
That's
again,
quite all right.
if people want to resume, but I think actually a lot of what, so I was sitting here, usually Scott's seen it, I'm like revising my presentation in real time to try and connect it to what's been discussed, but I feel like I was actually sitting and listening so deeply to the conversation that I didn't do that. So maybe that can be part of the conversation, is like connecting what you all have just talked about to the kind of questions that I'm getting a little bit selfish the older I get. And so like, I came and I like, as I was prepping, I was thinking, what do I want to bring to the council and give, but also what do I want to get? And so I'm looking for a lot of just input or feedback. So really selfishly, that's why I don't have a huge presentation, because I'm hoping to hear from everyone.
Well, you're at an advisory council, so you're in the right.
Yes, and it is nice to be here. I was actually sitting and thinking, maybe I'm not supposed to be here anymore. So
We're not talking about that.
Anyway, so I'll run through just some like really high level updates on the Rural Health Transformation Program. I'm usually pretty good at monitoring the chat, but
I'll try to do that.
I'll ask Scott. So
information on it.
I invite, like, if I don't touch on something and you have an interest in hearing about it related to the Rural Health Transformation Grant, I would love to hear those questions and hopefully answer them. And if not, commit to getting them answered offline and as follow-up. So Rural health transformation grant, I'm gonna like really simplify too. It essentially got funded at the beginning of this calendar year. It's a 5 year, and again, that's like air quotes because it's a really funky 5 years, but it's about 5 years of funding from the Centers for Medicare and Medicaid Services, or CMS. All 50 states got funded. New Hampshire got funded and you get your funding year to year. New Hampshire got funded at 204 million for this first budget period. We have authority to spend at this point, which is fantastic. I just went down to the grantee meeting for the first grantee meeting for all the 50 states. And there are a lot of states that do not even have an approved budget yet from CMS, which means they cannot spend any money. So we're in a good place where we have an approved budget. There's a lot of emphasis in the grant on getting money obligated very quickly. And what obligation means in this context is getting it out into contract. So New Hampshire put a big emphasis on getting our money out quickly, despite the existence of our executive council, which no other state has that additional bureaucratic hurdle. So we put forth very quickly sole source contracts for some large hubs that are going to then work as facilitating organizations to then distribute further out into the community. The governor signed an executive order in November to build or to create a pretty nimble unit called Go North to work this program. But part of it too, part of the intent behind that was to not make it a giant staff of people that are now state employees. And quite frankly, if anybody's worked at the state, it's a bureaucratic nightmare to even create positions and hire. So a lot of this hub approach was to also minimize that growth at the state level. So one of our hubs is the Foundation for Healthy Communities, which is why Peter Ames is here, and he'll talk, I think, a little bit about what they're working on right now. But I just wanted to give a high-level overview of the other hub contracts, all of which have now been approved at the Executive Council, which means New Hampshire gets a giant checkbox for obligating the funds, and that means that we can continue to access that first 204 million, not all of it, but most of it's out in contract for an additional 12 months after the end of this first budget period. So that gives us a huge amount of breathing room, although Peter probably still feels like it. He just looked at me like, no, we don't. But anyway, so the 5 contracts are, I set the Foundation for Healthy Communities. Peter will talk about it a little bit. I think of that one as it is like the most diverse set of things that ended up in one hub contract. Quite frankly, I think that's partly because the foundation has worked across a lot of different subject areas and with tons of different partners over the years. And so we tried to pick logical things to put in each organization based on their experience and their partners. So Foundation has a lot of the work around increasing access to care, whether that's through different delivery models. So there was a big emphasis on mobile integrated health, where you deploy like EMS for home visits, community nursing programs. That's the sort of idea of, you know, bringing care to people in their homes. There's also emphasis on delivering care in the community, but not home-based. So creating telehealth access points. There's other access to reducing financial barriers to care. So really supporting some of the safety net providers that offer sliding fee scales. A lot of tech and like emphasis on financial sustainability ended up in the foundation's contract. Tech solutions to help with financial sustainability, but also tech solutions to deliver care for things like remote patient monitoring and all that fun stuff. So that's the foundation. And I'll let you get into more, Peter. Then there's the Community Behavioral Health Association, or CBA, which I don't know if Maggie's still on here, but she could probably even talk more about it than me, but I'll give it a shot. So she's done a ton of work and helped to get that to the finish line as well. So that is going to be working across all 10 community mental health centers over the course of 5 years. to really transform that system of care to be more like consolidated services across the CMHC so that they can sort of share resources and kind of put some of the back of the office functions together and save costs. But ultimately, like one of the biggest outcomes, and CMS is very excited about it, is transitioning each of the community mental health centers into what's called a Certified Community Behavioral Health Center, or CCBHC. And again, Maggie could describe this much better than me, but really it's an exciting access thing because it really creates one provider where everybody should be able to easily access behavioral health services, agnostic of payer or even, what type of mental health service, you're interested in. So this is a big transformative project for the mental health system. So that's the second hub.
I just had a quick question as far as what's the first budget period time?
Oh, this is it. So
Just gonna break your brain.
I'm not gonna look at the videos as I explain this because everybody's just gonna slump down. It makes no sense. And Peter, you can tell me if I'm wrong because you probably haven't. So the first budget period is technically ending at the end of September 30th of this year. But that's, and it aligns with it's all weird. But so that goes through September, but don't go, $204 million by September. That is the window that we have to get everything obligated by. And then we have an additional, it's about 13 months after that to actually expend those obligated funds. And so the wild part is if you really start to dig in, that means we have overlapping budget periods, which is a financial nightmare.
408 million.
Yeah.
I'm just really confused about the 204 million because, and maybe you're starting to explain it to me, but my understanding is each year we get 100 million plus something.
Yes.
So I'm curious where the number 204 million came from.
So
that's not a 1 year thing, right?
It's 1 year. So, yep. So we're essentially, not full guaranteed, but generally we should be able to anticipate $100 million per year because that was the base funding for each of the 50 states. And then CMS divided, and I think this was in statute. And then they took the remaining funding from the $50 billion and they said this is going to be awarded based on a number of different things, some of which are the demographics of the state. So how rural are you? Again, very imperfect, but they had a bunch of metrics around trying to figure out are you big? Are you rural? Like how many people are there? So that contributed to how much funding you got. And then there were these technical scores or technical factors. So that was, how aligned is what you proposed with what we want to see? What are the policy commitments that you have said that you will, enact at your state level? So New Hampshire scored very high for the policy commitments, partly because we actually had a lot of them in place. And then we were willing to pretty much say, we're going to do all of the remaining policies. So you're funding that additional 104 million was based off of both those demographics of New Hampshire and the quality of the proposal that we submitted.
So you guys did an amazing job because there was nobody on the planet that thought we were going to get that much money.
Yeah.
So you guys did a great job.
Yeah, it's punching above your weight.
Yeah. No, you really need to be, when I was in Washington, they just said you guys were like stellar.
Well, and now, and again, I think this is like Peter and I's thing is now we have to keep that. And so future years of funding are going to depend less on the quality of the proposal and more on the implementation. And that's going to be really, I simplify it to two things. Are you spending and are you doing and achieving the things that you said you would do? And what's going to happen is there will be unspent money from budget period one. I guarantee it. There are some states that may never spend $1.
No.
That money goes back into a pot and will begin to be redistributed to other states starting in budget period 3. So we could go from 204 million down to 104 million the following year. I don't anticipate that, but it's a possibility. And then you could shoot back up to 300 million in year 3. So it's going to be, chaos.
And not to add to the chaos, but to add to the chaos, this administration will be gone in about 2 years. Is this program guaranteed, across administrations, or should the next administration kill it
Nothing guaranteed in life.
or amplify it, improve it?
Yeah. I think I heard Ed kind of mutter this, and this is essentially what I would say is like, really nothing's guaranteed.
Yeah, that's what I thought. I just wanted to be,
Back in taxes.
Yes, other than, so.
and Murphy's Law.
Yeah, so kind of going back into the hubs, then we have the Community Development Finance Authority, CDFA. They are the ones who are gonna have the funding. We put the maximum amount allowable by CMS towards capital improvement or minor renovation projects. So they'll be administering those funds, largely focused on funding capital improvements that will increase access to care. They'll be doing investments for helping support healthcare workforce, so actually expanding childcare capacity in areas where that's an identified need. And then they will be investing in some community-based projects that are really gonna tie in well to the population health work in this grant. So like senior centers, community centers, creating places where people can do physical activity. So those are the sort of three themes of the capital improvement projects through them. And then we have 2 hub contracts for creating really like a pipeline for workforce. So everything from, I never can remember this acronym, CTEs, Career Technical Education, the high school based training programs where kids can kind of enter early into the healthcare workforce pipeline. So the contract we have for that is with the Community College System, New Hampshire. So they are working to kind of strengthen that entry into healthcare workforce. And then they're also creating a paraprofessional academy with tracks to get people from those CTE programs or from a high school degree up and through like associates level and those types of trainings. And then they're partnering with the University System of New Hampshire, which is our other hub contract, to kind of continue that pipeline into the more bachelor's and advanced degree program. Yes.
So the first one, will they work with high school, do programs in high schools too? And the second one's more university based, and the first is community college and high school?
Yes, community college has, and they do have a working relationship with the CTEs already. One of the things they're exploring, for example, is CTEs have a hard time actually getting faculty to do the classes. And CCSNH is kind of considering whether they could staff those classes on behalf of the CTEs. So, so they're doing everything high school through to like associates level training. We just posted, Go North just posted the first RFP or request for competitive applications for our evaluation services, which is going to be really critical for us checking that box of those kind of 2 criteria I talked about for future funding, which is really being able to show CMS that we're doing what we said we would do and we're having the impact that we said we would have. So that's up and posted. We're beginning through our hubs to host some engagement sessions in different regions. So I did forward while we were meeting an email to Scott that he can send out to all of you with dates for upcoming regional forums that UNH and CCSNH are hosting together. It's going to be, I think they're 2-hour tabletop activities to really gather input into what are the workforce needs, what should they be thinking about as they shape and design their programs.
Yeah. Is the intent for those to be kind of limited to clinical development for workforce roles?
Not necessarily. I mean, it's been kind of interesting as I went out and did a roadshow with most of the federally qualified health centers, and in talking with them about workforce, they also were talking about things like front desk staff, finance staff. So I'm kind of interested to understand, are the needs just clinical? Because that's not what I hear. So
I was at UNH earlier this week speaking with some of the students, and the job market is just so abysmal for them right now. I was just curious as to where dollars were being shuffled.
But see, and that's the other like great input to get is like I keep saying, it's great to, the phrase used during the writing the application by people was, we're gonna flood the workforce. And I was like, well, we need to make sure that there are jobs for
Yes.
these,
I was
this
gonna
flood of
say.
workforce. So that's the other thing that we're asking for them to do is to really get some sense of like, if we really like crank up our number of enrollments and graduates, are they gonna have jobs in rural?
Sure, we just got a question. Right?
Sure.
Yeah, I was just wondering, I know that it was like identified that we kind of are rural state in general. So will these opportunities still be available to everybody in the state, or is it going to just be in what we might identify as more rural parts of New Hampshire?
It's a complicated answer. In the simplest way, I would say, I think people will feel that it is broader than what you would typically think of as rural. I say that because the state chose to identify certain provider types, federally qualified health centers and community mental health centers as rural. We were allowed to do that as part of the grant. So they were defined as rural and are therefore eligible for funding. So you could have a rural entity in Manchester or Nashua. But we have to kind of tease through with our federal project officer where the boundaries are of then saying, oh, well, then all of, Manchester is rural, because that it was not the intent behind the federal funding.
That was a fabulous question, because when I was in Washington, I asked the exact same question. And I also asked them, why did they ignore the inner city when they made these grants? Because I really think that's just as critical. And I didn't get a good answer. And I didn't get a good answer that was a better answer than they gave me. So, I mean, it's very, I mean, they basically said, no, you can't use it for any populated area. And then Whitney told me something very different. And I would listen to you over them.
Well, even Vermont, like, so, I talked with my colleagues in Vermont down at the grantee meeting, and they said they were getting a lot of pressure from their one urban FQHC to explain why they were not eligible for funding. And they were like, because you're not allowed to be. And so I guess the Vermont FQHCs were like, well, go talk to New Hampshire because they've made theirs. So this is again, like, we had 50 days.
Yeah.
Not great guidance. And so states did the best that they could. And I do think it is a cooperative agreement, which means that there is a really strong relationship between the states and their federal project officers, and opportunities to be refining as we go. Although they were explicit that we cannot do much revision from what was originally submitted. So we'll see what that really means.
I guess we have just defined as a group that a great question is something that I ask. I'm sorry, no, that was an awesome question.
I was going to define it as a question that Shirley asked.
No, I like that much better. I will take it that way. I was channeling you when I asked the question originally.
I see that ask about slides. Yeah, I'm getting pretty bad at having slides prepared because they all have to go through CMS for approval, which has a turnaround time. So I am learning to present without slides. But we are working at Go North to try and do a lot more written communication on our website and have some standard sets of slides to be able to use. Did you have a question?
No, how much time does he need?
How much time do you?
I can use whatever.
Okay.
I was thinking like an hour. Perfect.
I could like skip ahead a bit just to kind of make sure that Peter has a decent amount of time. We're really we're getting going, which is fun and exciting. We're establishing an advisory group that's like through the governor's office. But that's going to be a pretty small number of people. And I think they're going to kind of go out and do engagement sessions. We're finalizing our measures for the grant and drafting up specific project plans. And I guess what I was thinking is I went through the project narrative in preparation for the meeting today. And I had presented on this previously, but it's a good reminder. So I had put the SHIP Council in the grant application. And as somebody who'd been participating in these meetings for, I don't know how long before.
Years.
Yeah. I had thought there should be some opportunity to tap into the membership of the council to like help with this project. So I had talked about that this group would potentially be helping, with like bringing things out into the community because we have statewide representation and across, and also sharing within your own like colleague networks. That was one thing that, you know, communication's going to be really important for this. And we just don't, we have 3 staff at GoMore. So communication is hard to get out statewide. And so one way we'd envision using the council was to be those local kind of amplifiers of our message. And that would be talking about what is in the plan, helping to promote funding opportunities. So like even today, I went over that there's an RFP for evaluation services. If people share that out, that's just like all the better. And then even providing input into the work of the grant. So that's a big piece of what CMS wanted to see, was that the state was actually engaging and getting input in the course of the year, but also I have to submit our renewal application in August. So, you know, it'd be great to be able to get input. And then even like when I was listening to the conversation earlier about policy priorities, part of what led to our 104 million extra funding was our commitment to certain policy changes. And so being able to even share that, and we had a couple of bills this session that aligned with our policy commitments. And you may know it better than me, the pharmacy one we were just talking about, but like one policy commitment was around pharmacy scope of practice. And so I think it was Senator Rochford that sponsored a bill around pharmacy scope of practice. I don't think, or you're laughing, so maybe you.
No, it just came up with issues with that bill right now. That's what I was
Right now.
dealing with.
Yeah, it probably needs some refinement.
Yeah, hopefully
It needs a
does.
study group.
And we have time, like to be able to check the box and continue to get the funding for it. It didn't have to pass this session, but it's another good example of like, you know, is there an opportunity to kind of help co-create?
So I have a question, because I know we don't have a budget crisis at the state level now at all. Being
I
totally,
was like, what?
yeah, I know, I'm sorry.
Dripping with sarcasm.
Yeah.
So like, when we had the opioid abatement money, we had to look at infrastructure for managing that. Are you allowed to use any of the 204 million for actually how you manage it, given that we don't have state dollars to do it? In other words, are you allowed to hire people, pay them to oversee the entire project?
10%.
So,
Yeah, is it,
so there is a
yeah,
number, all
we can
right,
spend up to 10% on what
Okay.
they call indirect, which would include.
all right.
And I think
That's
that
kind of-
was also true for UNH because usually academic institutions overhead is a former researcher makes you cry. And 10% is like probably a fourth of what they usually get.
So I know we're like running short on time, but I do think, Scott, I jotted down, I got really excited by the council activities, those 3 ones that you had highlighted around it.
You may have been the only one.
I know, I was like, I kind of liked it, but anyway, so maybe this is a future conversation or maybe at the work group level, but again, like I was sort of coming today with just that question of like, how can the council advise on rural health transformation? How might it actually work to highlight the work? And again, like regional public health networks may be doing a fair amount of it. And then how do we help align the SHIP and the rural health transformation plan?
Well, and I think it was brought up in the work groups as it's not just necessarily regional public health networks being the ones that highlight. It's just it's a good way to get that communication because they're there.
Yeah.
But anybody can, you know, like even Ed saying, do you eventually have legislators even that are, I mean, anybody, again, Peter has a lot of context. I'm sure he could probably come up with 5 nominations sitting here not thinking, sure, we might want to nominate him just for taking this
It's
up.
not exclusive. It's not like employee of the month.
No.
Which I hate. It's inclusive. It's anybody who's doing work consistent with the state health improvement plan should be aware that that's true and should get some level of gratitude for doing that. Thank you for taking care of your block or your neighborhood or your town or your district. Were you aware? Did you know? 'Cause I think there's more going on. We do a lot of needs assessment. We never do much in terms of asset inventories.
Just that plan.
So I can hand off to Peter, who is gonna, I think, talk about upcoming, or I'll let you talk.
Yes. No, thank you, Whitney, and thank you for the invitation to be here with you all today. I think one of the things I want you to leave from my remarks is, as you've been speaking to, the opportunity around alignment for the work. And that is really of paramount interest for us, that we want to do this in accord with things that are already being done, leverage the work and the partners that are already in that space, and help that inform, future activities. And as Whitney mentioned, we think this body is the right body for a lot of those pieces, right? And so I'm grateful to have this first opportunity to come in today to hear and share updates. But it's the start of further conversations to make sure that we are aligned and that we're listening to all that you're doing. So I do want to again thank Whitney for her partnership to me and the foundation. This has been a lot of learning together. As was mentioned, the state did an incredible job, in the way they went about the approach in the fall, which is reflected in the award. And I would want you to know, like, that listening that the department and the governor's office did in the fall ended up right in their application, ended up in the foundation scope of services. So it really is informed by the field. So let me focus in a bit more about the foundation's work. Our role as one of the hubs is mostly about clinical interventions and supporting the clinical setting, whether it be access to care, improving care, or different ways of doing business. And that's certainly a frame that we bring to this, that we know there's going to be a very challenging environment for providers, patients, and caregivers in the time ahead. So notwithstanding that, this funding is an opportunity to do things differently, that transformation piece. And that's really the frame that we come to this with, is that we know there's challenges. This is not going to solve those challenges, but it is an opportunity and a glide path to do things differently that are sustainable after kind of the acute opportunity of the funding here over the next 5 years. And yes, for the foundation's work, it's really about care delivery, but it's broad. It's very broad. It's not just one type of provider or one care setting. It really runs the full spectrum. So within our scope, what we've been tasked with in the foundation, more than the other hubs, is the overwhelming majority of our money is going to go out into the field. And so we're serving in that role to provide a couple different levels of value to folks. Number one, to get the money out into the field. So the administrator for these funds, that is because, as Whitney mentioned, we have a diverse set of existing relationships, and that we, at our core, we're a quality improvement organization. So we have experience implementing models of care and different practices. And so getting it out into the field and providing as much administrative support as we possibly can is what we want to do. Our job is to make this as easy as possible for our partners, make sure the state gets what they need, but we want to take on as much administrative burden as possible. We're certainly hopeful that these funds will, be able to support everything from large health systems to a small community-based organization that's not clinical, and maybe it's their first time accessing federal funding. But we can provide that support to make sure they know they're compliant, and we're helping them along every step of the way. Yeah, the distribution of the money will go out through a competitive process, and as was mentioned, there's a lot of urgency to get this money out, even going through next October 27th. That's going to happen real quick for our partners that are trying to implement significant things here. So we will be issuing our first round of a funding opportunity later this spring. It won't be the only one, but it'll be the first one. And a couple of frames I would want you to know about for this one is that, we will be listening to the field to create the solutions that make sense for their communities, reflective of how the state and the governor's office has really driven this process, that it's meant to be informed by the communities and the people living and working there. So in RFP, it's not going to be overly prescriptive. It's really meant to solicit ideas from the field about what makes sense for individual communities. It will be, as an open competitive process there around that urgency, things that can be done relatively quickly, I think will be important in this first round to get things out of the gate and moving. Later rounds of funding, we expect our next one to be early fall, maybe different. We're going to learn from this process The next one may be a bit more prescriptive or focused, but we're going to learn through this round and learn with all our partners in the field. So I want to flag that upcoming opportunity for you. The Go North website is the place to go to learn about all those. So I'm sure you won't miss it. But I also want to highlight one approach in this round and going forward, going back to this alignment piece. There will be a premium on partnerships in this work. We are not looking for the new shiny thing coming from somewhere else in the country to solve everything. We've heard clearly from folks that don't duplicate, don't get in the way of, don't, put something out in the field that is not done in accord with existing partners and work that's already out there. So that's an important piece for us, and we want you to all hear about that we absolutely want to respect the space that is already as partners already in the field doing the good work. We're going to try and drive this to be, partnership focused, because at the end of the day, that's probably the most sustainable way going forward too. And we want to make sure that that's a key part of funding that's put out to the field. Let me pause there and I'd be happy to take questions.
Yeah, I have a comment and a question. So I think you addressed it very well. Actually, when somebody offers you a couple $2 billion over 5 years and then there's a dead stop, you always worry about cliff effects. And I like the reference you made that these are going to be sustainable. The other issue for me that's wicked important is that we do a really bad job at taking care of complex health problems that require integrative care. And I'm curious, especially in rural environments, that's even more challenging. And I'm curious if that's on your radar as a priority. How do we fund integrative care and how do we avoid cliff effects?
Yeah, on the cliff effects, and it's actually the other one as well, we're careful not to overpromise on what this money is going to do, right? That it's significant money for the state, absolutely, but it is designed to change things and put us on a pathway to do things differently so that it can carry on after this 5-year period. Sustainability is a priority for Go North. I think David's role is Director of Sustainability. Whitney, is that his title?
Financial sustainability.
Okay, all right. Well, in that space, yes.
Can't sustain you.
Right, no. So yes, that'll be an important piece. And I think all the projects will be looked at and say, this cannot, patch a problem that just resurfaces in 5 years. It's got to use a spark, with this money to do things differently. As far as the complex cases, that certainly would be something that could be relevant for the foundation's scope. I don't think it's specifically called out, but I'd say that's probably the space to look into, a creative pitch about what makes sense for this problem in our community and a way to solve it.
Yeah, we can certainly help with that. I know you put it on the website, but we can certainly help with all of our networks to distribute that opportunity. So,
Thank you.
Yeah. Any other questions for Peter? I know we just have a couple minutes, or for Whitney.
I put in the chat both the URL for Go North, which is to Trish's question. If you go to Go North, any funding opportunities from all of these hubs, plus from Go North itself, will be posted there. And there is an ability to sign up for notifications when things post. So ultimately, you'll go to the foundation's website to apply for their funding. But if you really want to know anything that comes up, I would sign up for that Go North notification.
Any last thoughts for Peter, Whitney, et cetera? No, we're coming down. Any public comments? I think the only public people are myself and Shirley. So I guess if Shirley and I don't have any comments. But I want to thank Peter and Whitney for coming. Both were running from another place, so we appreciate you stopping by here.
I was just going to make I may be in public, I don't know, but I don't know if it was truly clear. So Scott started a new job today, right?
That's right.
So he is
doing the same exact thing.
He is officially the anointed ship coordinator. So previously he was just helping me by doing what I asked him to do, but he's officially, so I just want to say congratulations.
Let's work with him.
Every time I hear that, I thought you were leaving. I was like, oh my God.
No, he's officially staying.
Well, I'm going to let people go on time. It's my first official act. And so thanks, everybody. We'll be in touch soon, but we appreciate your time. Thanks so much. Bye-bye.
Thanks, everybody.
Bye, everyone.
Congratulations, Scott.
Keep it ship shape.